We are going to study humerus. Humerus is a long bone present in the arm, on the upper arm. It is only bone present in the upper arm. As we see in the lower arm, there are two bones, radius and ulna, but in upper arm only humerus is present. Humerus proximally articulates with the glenoid cavity present in the scapula, and on its distal end it articulates with the radius and ulna. As we study the long bone, it consists of three parts: proximal end, the shaft, and the distal end. Proximal end consists of head, greater tubercle, and lesser tubercle. Greater tubercle is present on the lateral side, and lesser tubercle is present on the anterior side. The greater tubercle and lesser tubercle are mainly for the attachment of muscles. Head. There are three necks present: neck present, anatomical neck, surgical neck, and morphological neck. Anatomical neck divides the head from the rest part of the humerus, but surgical neck divides the upper and whole upper and greater tubercle and head, greater tubercle and head from the lower part of humerus. Morphological neck. Morphological neck is mainly formed by the epiphyseal plate. It is just above 0.5 centimeter above from the surgical neck. This is of the proximal end. This is the shaft. When we see the shaft, between the greater tubercle and lesser tubercle there is intertubercle sulcus. This is intertubercle sulcus. It is also known as bicipital groove. There are two lips. One is medial lip and one is lateral lip. The medial side of greater tubercle continues to form the lateral lip, and the medial side of lesser tubercle, lateral side of lesser tubercle continues to form the medial lip. There are three borders present in this: anterior border, medial border, and lateral border. Anterior border. When we discuss about anterior border starts with the lateral lip. Medial third part of it is the as we see about anterior border, medial third part of it is surrounded by deltoid muscle, and as we see near it there is deltoid tuberosity. Anterior border, there is deltoid tuberosity present. Here the deltoid muscles is attached. This is the medial border. The medial border is formed by continuation of medial lip, and third is lateral border. The upper half of the lateral border, which is on the back side nearly, it is surrounded by deltoid muscle. Some part of deltoid tuberosity is also present in the lateral border. In medial border, near the medial border, the nutriment foramen is present, which runs downward. See this is the lateral border. This is the lateral border. Radial groove, lateral border. This is the deltoid tuberosity, which is present some part of deltoid tuberosity present in the lateral side. There are three surfaces: anterolateral surfaces, anteromedial surface, and posterior surface. When we see about anterolateral surface, it is present between the anterior and lateral border. Deltoid tuberosity is present in this. When we see about anteromedial surface, it is present between anterior border and medial border. Upper part of this, on upper part there is bicipital groove is present. Nutrient foramen is present. When we see about posterior surface, it lies between medial and lateral border. Here this is posterior surface. It lies between medial and lateral border, the posterior surface. When we see about side determination, the head, which is present medially, this is the lesser tubercle, which is present on the anterior side. Greater tubercle is present on the lateral side. Here on the lower side, radial fossa, we will study about it. Radial fossa and coronoid fossa, it is also present in anterior side. And operculum fossa, which is present on the posterior side. This is the radial groove, which is present on the anterior side, intertubercle sulcus, or we will say intertubercle sulcus. This is a side determination. Now we will discuss about the lower end. Lower end is mainly irregular in shape. Sometimes it contains condyles. There are condyles. We can see in this diagram. There is condyle, medial epicondyle, lateral epicondyle, ridges. There are three fossa present in the lower end: radial fossa, coronoid fossa, and on this side operculum fossa. In operculum fossa, ulna is attached. In radial fossa, radius bone is attached. This is capitulum, on which the radius bone rotates. This is trochlea. On trochlea, the ulna bone get attached. On the posterior side, the operculum fossa is present. It restricts the movement of ulna bone during extension of elbow. It restricts the movement. The medial epicondyle is slightly bigger than the lateral epicondyles, as we see in the diagram. The medial epicondyle is bigger than the lateral epicondyle. We will see about muscles attachment. So we will see about muscle attachment. On greater tubercle, the muscles are attached are infraspinator, teres major, and supraspinatus. Supraspinator. On lesser tubercle, subscapularis muscle. एग्जाम में क्वेश्चन ऐसे आता है ग्रेटर ट्यूबरकल पे कौन कौन से मसल्स अटैच्ड हैं, तो उसमें हम बताएंगे infraspinator, teres minor, and supraspicularis. Subscapularis is present in lesser tubercle. This is the bicepharal groove or intertubercle sulcus. Three muscles are present in this: latissimus dorsi, pectoralis major, and teres major. As we go downward, in deltoid tuberosity, deltoid muscles is attached. Brachialis origin of brachialis is present on lower part brachialis, and on the posterior side triceps muscles originate, medial head of triceps muscle. ऊपर in radial groove triceps, lateral head of triceps muscles is attached. In the lower end, when we see muscles are brachioradialis, pronator teres and comer flexor origin are on the medial side, and on the lateral side extensor carpi radialis longus and brachioradialis is present. Aconius muscle is present on the posterior on the medial side.